Dr. Carr.
Hey, hi Leah, how are you?
Good.
Sorry for the mess. I just came back from work.
My name
Hi.
is Leah, and then these are my teammates.
Nice to meet all of you.
Hello.
Yes, me.
Hello, nice to meet
Hello.
you.
Okay, so you guys are med students, like, can you introduce
So
yourself?
we're in high school and we're running a campaign about epilepsy awareness, and we just had a few questions to ask about it.
Awesome. Happy to answer. I'm so sorry. It's just I was busy yesterday, I guess, right?
So the first question we have is, what are the neurological processes that happen in a patient with epilepsy?
Okay. So basically, the brain is made up of a lot of things. The main composition is neurons. And other than that, there are filler neurons, like helper cells, if I have to put it in very basic terms. And then there are some chemicals as well that are there in the brain. You must have heard about neurotransmitters, I believe, acetylcholine, gabapentin, and epinephrine, norepinephrine, serotonin. So all of these chemicals. So any imbalance in these chemicals can cause epilepsy. So and uh, the cells, they are connected with some channels, like there are potassium channels, there are chloride channels in the brain. So every cell, I'm sure you guys have read about sodium potassium ATPase pump, right? So the basic science. Yeah, it goes back to that basic science, that level. So any problems with the channels as well can cause epilepsy. So epilepsy is basically rapid firing of neurons.
Okay.
When the neurons they fire uncontrollably. Whatever we are trying to do right now, um, our actions are controlled by brain, right? And when brain starts to involuntary fire, which is not under control, uh, basically that's seizure. And the pathophysiology behind it, like I mentioned, it can be disruption of the channels. It can be issues with neurotransmitters. It can be injuries to the brain itself. So sometimes in patients, like somebody had a trauma, head trauma, and their brain was injured. So there is a scar tissue basically that's formed on the brain, right? So sometimes that scar tissue starts to fire. So the wave kind of happens and it starts from there and then it propagates. Does that answer your question a little bit?
Yeah, that answers our question.
Okay.
I have a question. Is it possible for a patient who experiences few seizures to experience more in the future?
Oh, yeah, 100%. So I would say one-time seizure is allowed for everybody.
Mm.
If you have seizure once in your life, that's okay. Because seizures can be caused due to a lot of things. It's not one issue that causes seizure. You can have high fever. Sometimes kids, when they are less than 6 years of age, and they have very high fever, 103, 104, they can have something called febrile seizures. So fevers, infections, any like issues with your electrolytes, high sodium, low sodium, especially low sodium, high magnesium, super high potassium. So all these issues can cause seizures, you know. So one time seizure
Yeah.
is allowed to everybody. But then if a seizure happens again, then we have to dig in and see what caused it. So long story short, seizures can happen again. And if they happen again, we have to dig in what is the cause, and how we can prevent seizures from happening.
Right. When you were talking about the scar tissue on like the brain, can is like a neurosurgeon go into it and like like have surgery and fix it to prevent seizures?
That's a great question. That actually happens.
Mm-hmm.
So, but the problem, Kyla, so the brain, different parts control different things, and
Yes.
there are some parts of the brain which control really important things like function of your arms, your speech, your language. And if the scar tissue is in those areas, then a surgeon is not going to go in and take out that area, right? Because you're
Yes.
going to lose the function. So when the area is not eloquent, then the surgeon can go and take out that area, and you can have reduction in seizures or even seizure freedom, which is kind of less. Uh, but yeah, there is remarkable reduction of seizures if that happens, if they're able to resect the tissue out. But there's a lot of issues with that because, first of all, you have to look at the area, if it is eloquent or if it is not eloquent, right? If it is
Yes.
controlling important things, then you're not going to touch it. And then, secondly, you have to map out that area. So, uh, a surgeon has to very clearly demarcate, okay, I'm going to cut just this much amount of brain tissue. If he goes 1 mm to the right or 1 mm to the left, it may harm
Mm-hmm.
neurons which are important. So
Yes.
mapping that area is also very important, and it's not an easy job to do. So long story short, yes, you can resect some areas which can help. A very common example I'll give you. Some people have um, medial temporal sclerosis. So temporal lobes, do you guys know about, like, there are different lobes, frontal lobes, occipital,
Yes. Yes.
temporal lobes. So sometimes the inner part of temporal lobes, they can get scar tissues, and that is a very common cause of from where the seizures begin.
Yes.
So sometimes surgeons, they go resect that area, and it's not a very important area. So patients actually do very well. But that means that they are actually lucky. But most of the
Mm-hmm.
time they cannot go and resect it.
Okay.
Okay?
If
Yes.
someone's parents has epilepsy, is it possible for them to inherit seizures as well?
Yeah, it is actually very possible. There are a lot of genetic diseases, genetic syndromes, which cause epilepsy, and that runs in families. They are hereditary. Okay. So, for example, if I have to give you an example, uh, I, I'll let you know once I I remember. Okay. So, yep. So, one of the questions we usually ask if a patient comes with seizures to us is if there is a family history of seizures, because epilepsy syndromes, they run in families. So, a lot of epilepsy. So, epilepsy is two times seizures, but they are at different times. It's not like a person had seizure today and within half an hour, without gaining consciousness, he had another seizure. So
Oh,
that's not considered epilepsy. Epilepsy is a person had seizure today, he is completely fine, but then after 4 months, he had another seizure. So two or more seizures at different times, that's considered epilepsy.
can
Okay.
you still classify it as epilepsy if the seizures were years apart?
Yeah. Yeah. Not necessarily it has to be within months. You can have two seizures, maybe 2 to 3 years apart,
Oh,
but and you can label it as epilepsy.
okay.
Hi, Dr. Carr. I'm Winnie, and I was wondering, is epilepsy a disorder commonly linked with comorbidities?
Okay, so I want to ask you, what do you mean by comorbidities? Like issues with other body organs or
Mental
epilepsy
health
causing?
issues,
Mhm.
mental health issues or other neurological diseases. Yeah.
Okay, okay, yeah. So it is common for epilepsy to have comorbidities. Obviously, um, if someone's seizures are not controlled, it causes a lot of burden to the family and to the patients itself, right? Because they are at risk of a lot of things. For example, we give patients driving precautions when they have seizures. As per Texas law, you cannot drive for 3 months if you have a seizure.
Mm.
And from your last seizure, you cannot drive for 3 months. So you have to be seizure free for at least 3 months before you actually can legally drive. And different states have different laws. So it puts a pressure on family, it puts a pressure on their mental condition. And uh, the other link to the question was if there are other diseases that can occur with epilepsy, then so my answer would be yes. Epilepsy is, I would say, a symptom, uh, maybe a symptom rather than the disease itself. For example, a patient had stroke, right? And the patient, basically, stroke is injury to the brain, and the patient somehow recovered, but then after 6 months he had a seizure, and we found out that the seizure, it started from the area that patient had stroke on. Okay, so the seizure was a consequence of the stroke he had, you know. So it can happen that there are comorbidities with seizures, with epilepsy.
What if a patient has seizures monthly and after their seizures they developed like digestion issues? Is that possible?
Well, I wouldn't say that's possible directly, but maybe indirectly, because if a patient has seizures, so the patient will be put on some medications that may have some GI, like gastrointestinal side effects, nausea, vomiting, constipation, diarrhea. Every medication has side effect. But I personally have not seen a patient who's not taking any medication, had seizure, but then eventually developed GI issues. There would be some
Mhm.
other factor that is involved, which will cause that. So maybe not directly, indirectly, yeah.
Mm.
Is it possible for a patient that has seizure medication not work for them and cause them more seizures?
Um, so seizure medication will not cause more seizures if you take the medication as prescribed. If it
Uh,
doesn't work for you, it will not help with seizure, but I don't think it'll cause more seizures.
okay.
Yeah, but if a patient takes the medication not as they are prescribed, they are missing doses, and or maybe they take a lot of pills together, then of course they can end up having more seizures.
I
So
see.
it depends, what are they doing. This question has to have like follow-up questions as well, you know.
Yeah.
What medications are harmful for patients who experience seizures?
So if I can simplify that, um, give you a very simple answer, every medication has side effects. All the medications that are present on this planet Earth has side effects. It may be mild, it may be moderate, it may be severe, and everybody experiences side effects in a different way. Your body is different than my body, right? So what side effects you may experience, I may not. What I experience, you may not. So the side effect profile is different for every medication. Every medication has side effects, but the benefits of taking the medication outweighs the risks of having seizure. You
Yeah.
understand?
Okay.
So, and the newer medications that have come up in the market, they are relatively lesser side effect profiles. So they are safer than the traditional medications we used in the past. They are very good medications now, and we have a lot of them. Like we have a very big medications set that we have options to choose from. So we always tailor make the medication as to what the patient would like, and if I can give you an example, there's a very common medication we use, Keppra. If you're doing this survey, you might encounter patients who are on Keppra, Keppra. So that's the brand name, but the generic name is levetiracetam. Forget about that. But so Keppra has the safest side effect profile. It doesn't affect your liver, it doesn't affect your bone marrow. There is no issues with your GI, but it causes anger issues. So
Oh,
in patients who have a psychiatric history, like a patient who has depression, who has bipolar, who has schizophrenia, I will not give that medication, even though Keppra is very safe. It doesn't have any side effects as such, but it causes mood issues, anger issues, agitation, you know. So we will refrain from using Keppra to those patients.
What are the other methods of preventing more seizures in patients with epilepsy?
So drugs are one, okay. The other methods we can, there are quite a few newer ways. Basically, they are implantable devices. One is called VNS, vagal nerve stimulator. That that has like whichever patient gets that, they have good amount of seizure reductions. Okay. Then there are surgeries. Obviously, like I was mentioning, medial temporal sclerosis surgery. So so surgery can happen. VNS placement can happen. Then diet. So some, especially pediatric population, the kids, if nothing works for them, there is a specific diet called ketogenic diet. So if you start taking a lot of ketogenic diet, you have good control of seizures. Studies have shown that. So that's something, especially pediatrics, kids. If somebody who comes to you for some counseling, you can tell them ketogenic diet, but it's a very specific diet. Not everybody knows how to do it. So you need like nutritionists and dietitians and everything to actually make a diet plan for you. Then we have other devices as well. Sometimes I've seen doctors using like a deep brain stimulation. That's another way. But those are stuff we kind of reserve for refractory cases. Like no medication is working, so we have to take the next step. The first and foremost step is to for medication, because that's kind of the safest. Every surgery has issues, Every surgery has risk. And even before that, I would say, if I have to broadly classify, just so for your all knowledge, if I have to broadly classify seizures, I would say seizures are of two types: provoked and unprovoked. So, provoked seizures are seizures which are like literally what the name suggests, something caused the seizure. So, if you take out that risk factor, you will not have seizures. So we don't necessarily put patients on medications if we think this is a provoked seizure. You know, the
Yeah.
example I want to give you is somebody who is a drug abuser, took a lot of cocaine, lot of methamphetamine, and came to the hospital, had a seizure. So this patient's seizure is likely provoked due to drug use. Okay. The second type is unprovoked seizure. There is nothing that was found on the workup, but still the patient had a seizure. So these types of seizures are dangerous because the risk of having a recurrent seizure is more. So you have to put patients on medications.
Right.
Okay.
Do you
Okay.
do you think complementary therapy works for people with epilepsy?
Complementary therapy, right? Like what?
Like doing yoga and meditating?
Well, stress is a big risk, like provoking trigger factor.
Yes.
So somebody who's stressed, somebody who's not sleeping well, um, some people just say that bright light is a risk factor, like provoking factor for some people.
Mhm.
So de-stressing yourself definitely can help. You just have to recognize what kind of trigger factor causes seizures for you.
Right.
Yeah.
There are certain medication or treatment methods that are more effective than others, like maybe oral medication is more effective than subcutaneous. Subcutaneous.
So I would say medications in general more or less work. It doesn't matter what route you go, you take it through. So, um, and I'm not sure about a subcutaneous anti-seizure medication at this point. So I maybe it's cooking in the market right now. We have not used anything like that, you know. And I hope something comes up like that'll help a lot because one of the big issues we face as doctors is medication compliance because it's hard for, a person to take pill every day, 2 times a day.
Yeah.
Hard. You have to wake up. It's like a habit that you have to make. Okay, I'm not going to miss my medication, otherwise I'm going to end up having a seizure. So if somebody can make a subcutaneous patch, like you just put it on yourself and just go about your day, that would be perfect. You don't have to pop a pill, you just have it there. Or you can have long-term injections, like deep pot injections. A lot of hormones have come up like that, You inject it one time, or there's an implantable device, and it slowly gets released. But seizure medications, we don't have anything. It's just oral medications or IV. Like when somebody comes to the hospital and they're seizing, we cannot give them oral, right? So we have IV medications. So I would say, I think every medication works if they are compliant with it.
I think those are all the questions we have today. Do you guys have any other questions?
No, I think you answered them
No.
all.
Yeah.
Well, we want to thank you for joining us today and answering all of our questions.
Of course.
Thank
Thank you. It was
you.
very insightful.
Yes.
I'm glad, and I hope you guys, whatever you're doing, the project, it comes out as a success, and wish you luck, okay?
Thank you so much.
Thank
Thank
you.
you.
Bye-bye.
Okay.
Bye. Have a good
Bye.
day.
Thank you.